Let me begin with this. Across the street from where we gather today at the K. Bailey Hutchison Convention Center is where the Biden administration is preparing to house up to 3,000 unaccompanied minors who cross the border. Similar sites exist in Carrizo Springs, Texas, as well as Midland, Texas, and that's just as of now. The way that we see the number of unaccompanied minors crossing the border, there's every reason for Americans to expect the number and size of those sites to continue to increase in the coming days. These sites are a direct result of President Biden's reckless open border policies that are causing a surge in border crossings and cartel activity. The administration has yet to provide answers that Texans deserve. How long will these children be here? What countries have they come from, and what COVID variants have they been exposed to? Are they being tested for COVID, and if so, how is the administration handling those who test positive? Is the federal government following CDC quarantine protocols? What happens to these children if they do test positive for COVID, and if they do become ill, who is it that's going to be taking care of them? The Biden administration must also answer for enticing unaccompanied minors into inhumane conditions that expose these children to traffickers, to abuse, and to terror. So far this year, more than 11,000 minors have been apprehended crossing the border into Texas. Children crossing the border rose 60% from January to February to more than 9,400 in February. The number of migrants crossing the border is at the highest since March 2019 and is on pace to hit a 20-year high. On Monday alone, the Border Patrol took in about 280 child migrants in the Rio Grande Valley sector. America needs to know how these children, some are young children, how they are coming across the border, and who is it that is helping these children come across the border. Americans need to know whether or not these children were harmed or abused in any way. They need to know if these children were assisted, coerced, or threatened by cartel members or by human traffickers. Were they forced to carry contraband as they made the trek across Mexico to the American border? All of this is vital information that can help America combat these human traffickers and prevent other children from being victimized. Americans deserve to know what the Biden administration is doing to get those answers. And Americans deserve to know what the Biden administration is doing to go after these human traffickers who are preying upon these young children. The Biden administration, to get those answers, should interview every unaccompanied child coming across the border. They should determine if any child has been harmed in any way or victimized by human traffickers. Things like this are already being done very professionally and very compassionately for children in America who are victims of human trafficking. The children coming across the border, they may share information about human traffickers or other abusers. This information can help us root out human trafficking as well as other criminal activity. Now, doing these things is the federal government's responsibility. But once again, it is Texas stepping up and doing what the federal government should be doing. Weeks ago, I launched Operation Lone Star to help secure the border and combat the smuggling of people and drugs into Texas. The Texas Department of Public Safety has deployed 1,000 DPS officers, agents, and rangers to support Operation Lone Star. Today, we are expanding the scope of Operation Lone Star to crack down on human trafficking. The Department of Public Safety will work with the already long-standing Governor's Child Sex Trafficking Team, as well as with other organizations and agencies that have experience in dealing with human trafficking and child trafficking. The Texas Department of Public Safety has been and will be apprehending unaccompanied minors who cross the border. And when they do, they will be seeking information about human traffickers as well as other crimes that may have occurred. Today, I am directly asking the Biden administration to allow the Texas Department of Public Safety to access this facility across the street at the K. Bailey Hutchison Center, as well as the other federally run facilities in Texas, to be able to talk to these unaccompanied minors. We must get to the bottom of the human trafficking and put an end to it. The thought of any child suffering at the hands of human traffickers is completely unacceptable. We have a duty to crack down on this heinous crime and to prevent more children from being trafficked and abused. And our mission is especially important now with a massive surge in border crossings and with an administration in Washington that has not laid out a clear plan about how to address this challenge about human trafficking, or candidly, to be able to address the massive surge that's coming across the border. So whether it's securing the border or fighting human trafficking, the state of Texas will always step up and fill in the gaps that are left open by Washington. And I want to thank the brave men and women of the Texas Department of Public Safety who are on the front lines every single day. Their efforts are vital to work to address this humanitarian crisis and to keep our community safe.
Governor, the first point that you made today was about the potential spread of the coronavirus and that these unaccompanied children may add to that spread. There are people out there, Governor, respectfully, that will say you dropped the mask mandate last week, you lifted all coronavirus restrictions. To those who say you aren't the right person right now to be speaking about the potential additional spread of the coronavirus, what would you say to them?
When we make decisions about opening up, which, by the way, when I made my announcement, Texas was already open up 75%. So we went from 75% to 100%. And that decision was based upon several different data points. It was based upon the reduction in the positivity rate, which the last I saw was yesterday. It dropped down to 6% for 2 days in a row. It was based on the dramatic reduction in hospitalizations, which is the lowest in 6 months. The positivity rate is the lowest in almost 10 months. And the vaccines have just continued to increase. Very importantly, we look at those who are most in danger of either losing their life or being hospitalized because of exposure to COVID. And those are people who are age 65 and older. And well over 55% of the people who fall into that most vulnerable population for COVID have received a vaccine shot. My point is this: decisions were based upon metrics as they existed at that time. Those metrics are changing, not by the positivity rate of the people who are coming across the border, but by the number of people coming across the border who have COVID and who may be bringing variants in. The key point that I wanted to make about COVID was really the variant. Know this: people coming across the border, for one, they're coming through Mexico, which is considered to be one of the hottest hotspots for COVID in the world. But how many of these kids are coming from Brazil? How many are coming from Central America that may have exposure to the variant in Brazil? We know others are coming from other continents across the entire globe. There are all these other variants. My point is this: the Biden administration has a responsibility to work collaboratively with state health services so that the state will be able to respond. The Biden administration has done nothing to work with state health services to inform state health services who are these kids, where are they coming from, what exposure they may have. We as a state are incapable of responding to this potential COVID challenge because of the Biden administration's refusal to provide us the information we need to be able to respond to contain COVID.
Funding by the White House to test migrants. Can you
Sure.
comment on why you rejected that funding?
I'll be happy to. The Biden administration offered the state funding to give to FEMA to do testing. The F in FEMA stands for federal. The federal government has the full capability of giving money and COVID tests to FEMA without even having to talk to the governor about it. They did not need my permission to get that done, as was proven by the fact that they have done it since my refusal to participate in it. All they wanted to do, that was a political game by the Biden administration where they wanted to try to have Texas assist them in their illegal immigration program, which we refused to do. The federal government has the money. They have the federal agencies, whether it be FEMA or Federal Health and Human Services or ICE, where these tests can be run. To be clear about this, if the Biden administration is doing it correctly, I'm going to explain the process. First, when a person comes across the border, they first encounter typically a Border Patrol officer. That Border Patrol officer, after the detention, they have to turn them over to ICE. And it should be ICE when they first go into a holding situation. It should be ICE that performs the test, that performs the quarantine, that performs the medical assessment. And that is the responsibility of the federal government, not the state government.